Welcome, aspiring medical students, to today's comprehensive lecture on the intricate field of medical microbiology. In this session, we will delve into the fascinating world of opportunistic fungal infections, specifically focusing on the mechanisms of fungal pathogenesis in immunocompromised individuals, immunological responses to fungal infections, and various clinical features, risk factors, and treatment options for prevalent opportunistic fungal infections. Fungi, as opportunistic pathogens, have evolved various strategies to cause disease in individuals with compromised immune systems. These mechanisms include adherence to host tissues, invasion through local factors and host barriers, production of toxins and enzymes that damage host cells, evasion of immune system surveillance, and modulation of host immune responses. By understanding these mechanisms, healthcare professionals can develop targeted interventions to mitigate the debilitating effects of fungal infections on vulnerable patients. The immune system plays a pivotal role in controlling opportunistic fungal infections. An initial line of defense is provided by the innate immune response, which includes phagocytic cells, antimicrobial peptides, and complement proteins. These innate immune components recognize and eliminate fungi through pattern recognition receptors, PRRs. Subsequently, the adaptive immune response, mediated by T and B lymphocytes, contributes to the clearance and long-term immunity against fungal pathogens. Abnormalities in these immune responses can result in either excessive inflammation or immunosuppression, both of which can exacerbate fungal infections. Candida infections are among the most common opportunistic fungal infections in both immunocompromised and immunocompetent individuals. We will explore the clinical manifestations of candidiasis, which range from superficial mucosal infections to deep-seated systemic infections. Additionally, risk factors such as immunodeficiency, indwelling medical devices, and broad-spectrum antibiotic usage will be discussed. Treatment options, including antifungal medications and adjunctive therapies, will also be reviewed. Aspergillus species are responsible for a range of clinical presentations, including invasive pulmonary aspergillosis, allergic bronchopulmonary aspergillosis, and chronic pulmonary aspergillosis. We will examine the specific clinical features associated with each form of aspergillosis, as well as the risk factors that predispose individuals to these infections. Early diagnosis and targeted antifungal therapy are crucial for improving patient outcomes. Cryptococcal infections, primarily caused by the fungus Cryptococcus neoformans, present unique challenges due to their ability to affect both immunocompromised and immunocompetent individuals. We will explore the etiology of Cryptococcus infections, including its environmental reservoirs and modes of transmission. Diagnostic approaches, which include microscopic examination, antigen testing, and molecular methods, will be discussed. Treatment options, including antifungal medications and management of complications, will be emphasized. Pneumocystis pneumonia, PCP, remains a significant opportunistic infection in individuals with HIV/AIDS. We will discuss the etiological agent, Pneumocystis jirovecii, and the unique challenges in diagnosing PCP due to its atypical clinical features. Strategies for prophylaxis and treatment, including the use of trimethoprim sulfamethoxazole and adjunctive corticosteroids, will be addressed. Zygomycetes fungi, including Mucor and Rhizopus species, can lead to severe and often fatal infections, especially in patients with uncontrolled diabetes or immunosuppression. We will analyze the pathogenesis of zygomycosis, emphasizing angia invasion and the destructive capabilities of these pathogens. Treatment options, from extensive surgical debridement to antifungal medications such as amphotericin B, will be explored. Histoplasma capsulatum, the causative agent of histoplasmosis, is endemic in certain regions, particularly areas with bird or bat droppings. We will examine the epidemiology and geographical distribution of histoplasmosis, including its association with occupational and recreational exposure. The clinical spectrum, ranging from self-limited pulmonary infections to disseminated cases, will be detailed. Diagnostic approaches, including antigen detection and serological tests, will also be discussed. Blastomyces species, endemic to specific regions with moist soil, can cause a range of clinical manifestations, including pulmonary, cutaneous, and disseminated infections. We will investigate the different blastomyces species causing these infections, their specific ecological niches, and the modes of transmission to humans. Robust diagnostic methods, encompassing fungal culture, serological tests, and molecular techniques, will be covered. Treatment modalities, including the use of antifungal medications, will be explored. Accurate and timely diagnosis is vital for effective management of opportunistic fungal infections. We will discuss a wide array of laboratory diagnostic techniques, including direct microscopy, fungal culture, antigen detection assays, polymerase chain reaction, PCR, and serological tests. Their respective strengths and limitations in identifying specific fungal pathogens will be highlighted, facilitating appropriate patient care. Antifungal medications form the cornerstone of treatment for opportunistic fungal infections. We will explore the different classes of antifungal drugs, such as polyans, azoles, and echinocandins, and their mechanisms of action against fungal pathogens. Considerations for drug selection, dosage regimens, and potential adverse effects will be discussed, with an emphasis on personalized treatment plans. In healthcare facilities, preventing the transmission of opportunistic fungal infections is crucial to protect vulnerable patients. We will examine the infection control measures, including proper hand hygiene, personal protective equipment utilization, and environmental cleaning and disinfection protocols. Furthermore, preventive strategies, such as antifungal prophylaxis and vaccination development, will be discussed to minimize the risk of nosocomial fungal infections. Understanding opportunistic fungal infections is crucial for healthcare professionals. Diagnosing and treating these infections effectively is key to improving patient outcomes. Your role in prevention and management is essential.